I want to talk about surgery now. This may be what your first experience of the treatment process is, whereas mine came after the chemotherapy. So I can only speak of my experience, of course, but I think the most important thing is to talk to your specialist surgeon and talk about a surgical plan. So, as I've said in a previous episode, I asked my surgeon if she could just remove the tumour and create a smaller breast for me, and then match the other one up. She gave it some thought. She didn't give me the answer then and there, so I went back for a follow-up appointment and she said that she would consider it. When it came to the actual day of the surgery, she sat me down to talk about the surgical plan, as they do, and for me to sign a consent form. And she drew a little diagram of what she intended to do. And she explained that her idea, which was just to remove the sort of side and front section, she was used to doing, and she would be more confident of getting all of the tumour. I asked if she could try to remove it and then create the smaller breast. So what she said to me is, I won't know until I get in, till I start the surgery, and I can't say for certain, but I will take into account your request. I also didn't know whether I might have needed a full mastectomy, because that is the thing, they've got all these test results, but until they actually look at the tumour and look at the surrounding tissue, they don't know how they will proceed until that point. So I was prepared and I signed a form for whichever option was needed for first priority, my health and my well-being. The next thing I would talk about now is the anaesthetic. I'd had a lot of surgeries over the years, as I mentioned before, and I'd had a reaction to the anaesthetic, where when I was in the recovery room I couldn't stop shivering and shaking. So over the years they'd used heated blankets, blow heaters, all sorts of things. But I spoke with the anaesthetist and he said, don't worry, I will adjust the cocktail of the anaesthetic so you'll be fine. And I didn't believe him. I thought, well, thanks for trying, but I said, well, can you have a blanket on standby or a blow heater just in case? And actually, he was right. He was amazing. I came around, I wasn't shuddering or cold at all. I just was a bit weary and I felt okay. I was very pleased then to be told that my surgeon had managed to create a smaller breast, and hopefully that would be enough, but until they send off the what they take out of you, they always send that to the lab. She'd taken a margin around it for safety, but until she had the lab results, she couldn't say whether she got all of the tumour out. But I was left with a higher, perkier, smaller breast. Then the other question that I asked before the surgery, which was of concern to me, was how much pain will I be in afterwards? So I'd had a hysterectomy, a bladder surgery, gallstone removal surgery, gallbladder removal. And there was quite a lot of pain involved in that, particularly the bladder surgery. I remember needing morphine and so on. But the nurse sat on the bed, she said, don't worry. She said, because it's not an internal organ, there's nothing like the amount of pain that you would have with other types of internal surgery. And she was right. I was really pleasantly surprised that I came out with, obviously all bandaged up, and for about 2 weeks you've got to keep it dry, so put a sort of a plastic thing over yourself in the shower, or if you've got a handheld shower, just spray around yourself. But when the dressings came off then, when I returned to the hospital and they removed the dressings, I was amazed with the result. And although, you know, I had to say goodbye to my nipple, I'd come to terms with that and what it looked like, and I was just really pleased that it was something close to my normal self. Now, obviously, if I'd had a mastectomy, then they would have provided me with a piece to go in the bra to leave hospital, because they do actually provide you with a bra for when you leave the hospital. I was really pleased with that, and in my area that is free. That was without charge. You get the one, and this, I've still got it, is the bra. So it looks a bit like a sports bra, and it's got a pocket each side so that you can pop the filling in to wear home. And I needed more than one because I was wearing this quite a lot. So I went online and had a look, and there's a company called Amoena, Amoena, and they are a company that specifically provide bras and clothing for women who've had surgery on their breasts or full mastectomy. And it was lovely. They sent me a catalogue and I had a look through, found the exact bras so that I had two to alternate. And there were lots of other things in there. There were things to put in your bra to give the impression of a nipple. And there were all sorts of sizes of the inserts to the bra, depending on how much you'd had removed and what you needed. I obviously I didn't use that. What I did, I just squished my bigger one into the same bra, obviously, until 6 months later I had the surgery on that one. So this bra, very comfortable, holding everything, all the bandages in place. But what I did find is that, you know, if you're carrying a bit of weight below here, by the end of the day, this part here has sort of gone like that and is digging right in and is uncomfortable. So really good, particularly early in the day and when you're standing up, but I had trouble with it later. So I tried different ones. I bought this one. This is very inexpensive, Tesco's, I think. That was quite comfortable, but it has got a sort of, not padding, but a thick layer, and I just think I look too big with it on, so I went off that idea. And then finally I went back to underwired bras, and this is my favourite one at the moment, which is a bit of a balcony, and because my scars are healed, I can wear it. But of course, when your scars under here are still quite tender, then you don't want anything rubbing against it. Now, while we're on the subject of bras, I had this conversation when I went, after I had my second surgery, to reduce the other breast to match. And I saw a different surgeon to mine because mine was on maternity leave then. And it was a man. And we had this funny conversation where we talked about bras, and he said, I prefer non-underwired. And I said, well, I prefer underwired. I find the non-underwired just sort of double up and dig in. And he said, well, I prefer no bra at all. And I said, am I allowed to do that? You know, am I allowed to go around without a bra? It's not going to just all, you know, flop out or something, or the scars won't be able to hold the breast tissue. It's a bit daft, really. But he said yes. So, that was freeing. Because certainly around the house and in certain outfits going out, I just don't wear a bra, and then I haven't got it digging in anywhere, which is lovely. But it seemed a funny conversation to have with a man, albeit a breast specialist surgeon. With your scars, I think there is a lot you can do. Obviously keeping the area clean, but my friend who worked for a pharmaceutical company, not this one, but she put me onto Dermatix. Dermatix. It's a silicone gel, and I asked my doctor for it. I'd used it before for the scar with the hysterectomy and other surgeries, but I asked my doctor and I got it on prescription for the breast surgery, and I would just have my shower and apply it to the scars. Marvellous. You know, it took a while, but now my scars are barely visible and don't give me any trouble at all. So it is worth investing in it or asking the doctor for that. I did find after I had my surgeries that I had difficulty sleeping. You know, you're not comfortable. You don't want to lie on the side. Maybe you normally lie on that side, and then you're going to retrain yourself to lie on the other side, which I have successfully done now. But I found that getting various pillows in different positions, particularly if you're on that side, if you put a pillow between your knees, then it lifts your body up slightly so you're not putting the pressure on the breast. And also if you lift your neck up sufficiently, not like so it's too high, so it's obviously straight in line with your spine, but that was how I was able to then sleep comfortably. And it is really important that you get your sleep. But if when you first come out of hospital, if maybe you've still got drains in, which take any fluid from the surgery into a bag, then it's really difficult and you've got to sleep on your back. I found my V-pillow helped a lot then, but if you position all your pillows so that you're not lying too flat, you should be okay. But I would expect that you would have some sleep loss initially. And that's the time when the meditation, put a meditation app on. I slept alone during this time because I was afraid my husband might lash out in the night and knock me accidentally. And I just needed to spread myself with all these pillows over the bed. So if you have got that option, then that's good for your peace of mind and your comfort. But at the same time, you do feel alone. And the middle of the night is the worst time for any worries and concerns that will come into your head. That's when they'll come, 3-4 o'clock in the morning. But what I would do is put the app on, listen to someone's voice, and tell yourself that how you're feeling at that point is not how you'll feel in the morning. That's what I did. And it is absolutely true that I would nod off eventually and get a couple of hours, and when I woke up and it was morning, then I would feel better and more positive, and another day closer to healing.